Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you have requested. The area of interest is 1625 and 26 for the implant placement. Since this is a partial CBCT requested by the doctor, we only concentrate on the upper jaw. This is the transaxial view, or basically the proximal view of the upper right six. As you can very clearly see, we've got an upper right six with a palatal, mediobuccal, and distrobuccal root. All three roots have periapical infections, and there is not significant bone structure for an implant placement here because we don't have a buccal cortical plate. A relative idea of where the buccal cortical plate would have been, you would have had 30 millimeters of ridge width with only 3 millimeters of height. So this area would need bone augmentation and possibly a sinus lift as well. The bone quality in this region is D4. Moving to this is the upper left 5. As you can clearly see, PTR with an endodontically treated tooth. The buccal canal has been missed. This region has good bone support for approximately 11 millimeters of ridge width with a good 14 millimeters of height, but due to the periapical infection and the lack of bone in the periradicular areas, an immediate implant placement is not going to be possible. We would highly recommend placing a graft and waiting for an implant placement. This is the upper left 6. The upper left 6, as you can very clearly see, periapical infection on the distal. Then we've got a over extruded GP in the palatal, and then we've got the mesiobuccal where we have a periapical infection here as well. So now, because of the widespread roots of this tooth, we have approximately 13 millimeters of ridge width with 7 millimeters of height. So here, but we also have a cortical plate perforation at this point, communicating with the sinus here. So after the extraction, would highly recommend that this area needs to be grafted. We will place 3 virtual implants and show the positioning of the implant. This is how it looks with the virtual implant planning. We placed 4.310 in the 5 and 4.38 in the 6s on both sides. Thank you very much.